investment in public health is a really small proportion of all health expenditure growth. What we tend to see also is that in those countries where there is more investment in health, it tends to go substantially towards healthcare, and the gap between public health and the rest of healthcare expenditure tends to grow. So somehow, even as health expenditure grows as a percentage of GDP, the proportion of public health expenditure becomes even smaller. Why does this happen? Some thoughts which I share from my experience. The very first thing is that public health is sometimes not easy to communicate. I don't know if you have had the opportunity to visit the stand of one of our partners, ASFA. They have this big project. This is public health, which has also been carried out in the US, explaining what it is that public health is and why do we need to invest in public health. So that's the very first thing. The second thing, I think, is that there is this idea that public health only gives dividends over a long time, and I think the Health Equity Status Report is managing quite nicely to challenge this assumption. But for a very long time, I think even we in public health have been talking about long-term approach, long-term investment, when in fact we know that the results of this investment are very apparent and very, very quickly. This, in the lunchtime session on vaccination, we were reminded about a paper published by colleagues in Italy, which showed that measles resurgence and lack of vaccination was associated actually with cutbacks, including in immunization services. So I think the key issue with public health is that when there is a crisis, you get a response. And I think that nowhere is this more apt than if one, for example, compares the mission letters of the European Union Commission where health is concerned 5 years ago to the outgoing Commissioner Andriukaitis. The text was very much that health is a small thing. We should have a prudent approach, not be too ambitious as a European Union where health is concerned. Compare that to the mission letter given now to the incoming Commissioner, Stella Kyriakis, and we will hear more about this tomorrow in one of the plenaries, and there has been a change. And as much as we would like to think that as NGOs working and lobbying and carrying out advocacy, we have managed to shift this position, humbly we have to acknowledge that this shifted position was probably also largely brought about because of the resurgence of measles that reminds everyone that you can't be complacent where health is concerned. Another thing which I was made aware of recently is that ministers have a very short mandate of health increasingly in many countries, and the sense of urgency as soon as they enter a new domain is to fix what is urgent and what will really give them quick and immediate results. And I think it's over there that we need to try and change a bit the thinking, which is why we are trying to link better public health and the social determinants of health to the health system. So we have unfortunately over the years sometimes seen a focus on health services and the focus on the upstream determinants of health as being in competition, and trying to get public health to concentrate very much on the upstream determinants and forgetting a little bit about our colleagues working at the coalface in the health system. I think that is wrong, and I think that basically we need to work with our colleagues who are bearing the brunt of the lack of investment in public health and the wider determinants of health, I think, more than anything. Because as a public health conference and community, we are very happy that we have targeted 2,500 participants. When we speak to our clinical colleagues, they are in much larger numbers. So I think we need to dedicate some of our efforts to convince also them to be lobbying and advocating with us that they are going to continue drowning under the pressure unless we can make a case also for strengthening health services, but it won't be easy.
Thank you very much, Natasha.